What is asthma? Asthma is a chronic disease characterized by inflammation of airways and bronchial hypersensitivity. This in turn causes a lower airway obstruction that prevents oxygen exchange and can be fatal if not properly treated. Asthma causes wheezing, chest tightening, shortness of breath, and coughing. Symptoms range from mild to severe and can happen infrequently or multiple times a day. Severe symptoms are called asthma attacks. Who can asthma affect? Asthma affects 334 million people worldwide.
9.8% of women over 18 have asthma.
5.4% of all male adults over 18 years and older have asthma.
As a female, you're more likely to be affected by asthma. What increases asthma? There are certain things that can trigger asthma, such as tobacco smoke, cold weather, perfume and fragrances, pollen, stress, exercise. What happens during an asthma attack? Your lungs hyperinflate, the smooth muscle tissue becomes swollen, lung alveoli thickens, and mucus glands hypersecrete fluid. How is asthma treated? There are two main types of treating asthma. 1. The long-term medications, usually an inhaler of a corticosteroid, or 2. The fast-acting inhalers such as albuterol. The alternative medicine approach. Asthma is one of the top 15 most common medical conditions treated with an alternative medicine. These include tropical chest rubs, herbal teas, spicy foods, high caffeine products, biofeedback, breathing exercises, and yoga. Although alternative treatments are great, they can be very dangerous for asthma patients. Using herbal teas may actually worsen asthma symptoms, as pollens of these plants can further irritate airways. Consuming or inhaling menthol-containing products only induces the feeling of increased airflow. It can actually cause inflammation and irritation in concentrated amounts and can chemically burn when undiluted. Yoga and other mind-body approaches have been reported to help overall well-being, but are not helpful enough to be replaced by a pharmaceutical treatment. Asthma that is not controlled with pharmaceuticals will worsen over time. Repeated inflammation will cause scarring and trauma in the lungs, which in turn makes the lungs more resistant to proper treatment. Despite all things that you can't do when you have asthma, and despite the adjustments you have to make to cope with asthma, you can still live a fully normal life.
Thanks for watching. Make sure to like, subscribe,
And comment
for more asthma.